Hello, and welcome to the Care Machine Sustainable Healthcare Podcast. I'm your host, Professor Helen Mees. The World Health Organization's Director General Special Envoy for Climate Change and Health labels climate change as the biggest threat to health in the 21st century. The effects of climate change on health are widespread. It can act as a threat multiplier, exacerbating existing dangers to human health, and also create new risks. Extreme weather events like heat waves, floods, droughts, and wildfires lead to direct and indirect health impacts on communities that they affect, which are often those that are most vulnerable. In its sixth assessment report, the Intergovernmental Panel on Climate Change stated that human activities have unequivocally caused global warming, a statement supported by over 99% of the climate-related peer-reviewed scientific literature. Changes in the atmosphere of the Earth, oceans, cryosphere and biosphere are all a result of increased temperatures, having transformed weather extremities across the planet. Although the effects of climate change on health are disproportionately weighed towards those countries that have contributed the least to climate crisis, its threat to human health is historically high-emitting countries, such as the United Kingdom, and it also affects them too. Recognising this, the NHS has made substantial progress in becoming more sustainable and less carbon intensive, with various initiatives implemented at both the organisational and national levels. Many trusts have made further progress by employing dedicated staff, upgrading building efficiency, switching to renewable energy, and changing procurement practices. And our guest today has been part of that vanguard right from the start. Dr. Richard Hickson is a consultant anaesthesiologist in critical care medicine and an honorary senior clinical lecturer at the University of Exeter. He has worked at the County Durham and Darlington NHS Trust for over 24 years, with roles including Trust Clinical Lead for Sustainability, Deputy Medical Director for Clinical Standards and Governance, and Lead Clinician for Anaesthesia. Since 2017, Richard's lifelong passion for the environment, and especially the ocean, developed into a fully fledged need to address the impact of healthcare on the climate crisis, focusing on sustainability, education, and global equality across the sector. This has led Richard to co-found Healthcare Ocean to help tackle and understand how anthropogenic activities, including healthcare procurement, container shipping, and molecular pollution, adversely affect the marine environment. His goal is to ensure oceans, coasts, and inlet waterways are never forgotten in NHS net zero planning. I began by asking Richard to share his twin passions of medicine and marine life. Richard, in my introduction, I talked about your career as a consultant in anaesthesia, but you are deeply passionate about the sustainability of the medical profession and the impact clinical care is having on climate change. Can you tell us a little bit about how you came to recognise this as an issue over your 20 years plus in the NHS, and what motivates you to want to address this?
Well, thanks, Helen. Yeah, well, it really started, to be honest, when I was a child. I was just a nature-loving child, especially when it came to the ocean ecosystem. Most of my favourite animals were marine mammals, such as the Yangtze river dolphin, the blue whale, sperm whale, etc. And to be honest, I actually wanted to be a marine biologist when I was at school, but the careers advisor kind of persuaded me that the ocean wasn't particularly important, and so I was struggling for a career, and I went into medicine. That was in 1987, and then obviously you go through medical school, you have a career, you do exams, and really I got distracted for many years until about 2012, I think it was, when I was just beginning to hear more and more about the environment, and it just reignited all these passions from when I was a child. So I started reading a lot more about the environment. And at that time as well, I was also being enticed into a new direction in my own career, moving from clinical work to medical management. And in about 2014, I started in a senior medical management position, which again distracted me for several years. But during this time, I just again was I found myself reading more and more about the environment. I registered domain names like greenhospital.com and things like that. And I didn't really do anything with them. But then in 2017, when I was in a executive meeting, I just remember asking the executives in the room, what's the environmental impact of our operations here in the hospital, and what are we going to do about them? And
Yeah.
the answers varied from kind of enthusiasm and intrigue to just complete indifference. And I was basically challenged in that meeting that if I wanted to do something about the hospital's impact on the environment, then I could do so, but do it in my own time without resource. So I said, okay, fine. I resigned from my medical management job and I set up the Trust Sustainability Group and just progressed from there.
That's amazing. I mean, it's such a journey, but it's obviously come full circle for you, and it feels like it's a natural place now for you to be.
100%. It was just a real new lease of life for me. It was combining this childhood passion for the environment and for nature with the medical job that I was in. I'd worked very hard to get to a senior position within the trust, and suddenly I found myself with the ability to use this position and use this voice to open up all sorts of doors. So from setting up the Trust Sustainability Group, I went on to work with Integrated Care System, James Dixon in the Northeast, to progress the regional sustainability group. I reached out to the Centre for Sustainable Healthcare, became a trustee of their charity. A couple of years, I reached out to NHS England because I started to become interested in sustainable procurement and the footprint of our supply chains, and was welcomed into their sustainable procurement forum. So suddenly all these doors just started opening. And that was just incredible for me, because I was becoming so concerned. I was entering that eco anxiety phase and just wanting to find routes to deliver actions. And then we had this pandemic, COVID, and suddenly I became acutely aware what one virus could do to our healthcare system. I knew what Lancet Countdown was reporting. I knew that our vulnerabilities in healthcare from the climate emergency were huge. And this just motivated me so much to use a position and the voice of health and healthcare to reach out and to try and drive actions, positive actions.
I definitely think for most of us, that's how we've come to this position where we felt that there was nothing around us that we could really do. So we've had to drive change ourselves. And I think hearing your story, I think really supports a lot of people who are listening to this podcast or watching this podcast that are in the same sorts of positions. So hopefully you're going to infuse them into really committing to this sort of area. For those of us that are already in the sustainable arena, we're very well aware of the statistics that the consolidated global healthcare medtech industries are considered to be the fifth biggest producer of CO2 on the planet. But for those just coming to this topic, what kind of effects are climate change having, and what is it creating, and the impact that it's having on people's health globally?
It's a huge question, Helen. And I think firstly, it's important to realize that climate change is really just one element of the global planetary crisis that we're seeing. We often talk about the triple planetary crisis of climate change, pollution, and loss of biodiversity, but these still really silo the challenges. And I'm very much in favor of the planetary boundary model from Johan Rockström and the Potsdam Institute, which divides the kind of planetary challenges into 9 areas, 9 interconnected areas such as CO2 emissions, aerosols, genetic diversity, water, resources, loss of tree cover, this sort of thing. So these 9 interconnected areas, they really they define the safe operating boundaries for a livable planet, a planet that is existing within its climate niche. Because for the last 10,000 years, civilizations have been developed within the Holocene, which is an incredibly stable climate period of a CO2 for the majority of the Holocene, sitting about 280 parts per million. And what we are now doing with challenging these planetary boundaries, and we have breached at least 6 of these and possibly 7, is that we are taking the planet outside these safe operating limits. And we've only existed as Homo sapiens for 280,000 years. So now we're living in a world where we are seeing CO2 levels that we've not seen for 3 million years, ocean pH levels that we haven't seen for 15 million years. So we've never been here before. We are seeing temperature changes 20 times the speed of the Paleocene, Eocene thermal maximum 56 million years ago. And we are heading for 2 billion people living outside of the climate niche by the end of the century. And climate change and the drifting out of these planetary boundaries is simply going to affect billions and billions of people around the planet. We're not talking about numbers of millions here. We are talking about an absolute change to the way civilization exists on the planet. Another example with ocean acidification is since the Industrial Revolution, we've seen the ocean acidify 0.13 pH units, which is a 33% rise in hydrogen ion concentration. And that is a faster change than the planet saw at the end Permian extinction event that saw the loss of over 90% of life on Earth. So we are in an extreme serious situation. And the Lancet Countdown, the latest from 2024, beautifully describes the impacts that this will have on human health through extreme weather events, including drought and flooding, extreme heat, which obviously we're witnessing at the moment, especially across Europe, the fastest heating continent on the planet, through infectious diseases and the changes in distribution of dengue and West Nile virus and Vibrio and malaria. We are seeing food insecurity, water insecurity, and the predictions, if you look at the IPCC, of what the climate and planetary emergency is going to do to net primary production in the ocean, there is a massive reduction in low latitude net primary production, which means food insecurity again for millions and if not billions of people in low latitudes. These people will migrate, borders will break down, we will have war for food and clean water, essentially. So it is destabilizing of modern civilization. That's the effect of climate change, and the impacts on our health are going to be incredibly demanding. And our healthcare systems, we saw what pressure they came under with one virus, COVID. Well, you imagine all these healthcare pressures. I believe personally we are going to struggle to keep people healthy.
Yeah, I would agree. And, you paint such a vivid picture there with what you've talked about, just putting us into the history of this planet. We are creating a catastrophe that has really not been seen since the age of the dinosaurs. And that is frightening for anyone, regardless of whether you're in medicine, in science or engineering. That should be something that we're all really, really wanting to do something about.
Yeah, 100%. And I think I could be challenged, of course. People could say, well, actually, we have not lived through a mass extinction. We have not lived through this environment. Maybe the world will adapt. Maybe we will adapt. Maybe things won't be quite the same as they have been during existing extinction events. And I completely acknowledge that we are heading into the unknown. But I would rather be on the side of predicting the worst case scenario and it not happening, rather than sitting back with business as usual, seeing this all unfold and then go, oh, whoopsie, we had the chance to respond there and we didn't. So I would rather err on the side of precautionary principle and step in as much as I can, because I believe all the changes we can make will simply be so positive for global citizens. Anyway, the reductions in inequalities across the planet and focus on the basic needs of all rather than the luxurious needs of the few. I think we can create a more egalitarian society, which I think will benefit many people.
Yeah, I absolutely agree. And certainly from the viewpoint of an engineer, I know that much is being and could be done to improve medical technology design, particularly, and the clinical infrastructure to reduce some of these effects that you've been talking about on the climate. But what kind of things are clinicians and medical practitioners like yourself doing as far as the treatment of patients is concerned, and how are those changes being implemented?
I think the most important thing we have to do, Helen, and it's not so much of what we're doing, but what we perhaps want to do and we're not doing particularly well, is maintaining the health of the population. The most environmentally sustainable healthcare is that which does not need to occur, because all healthcare has an impact. Everything we do has an impact. It's impossible not to. So I really think we need this massive investment in the ideology and the infrastructure around maintaining health rather than treating disease. Treating disease is massively important, especially treating it efficiently, but we need everybody to have a sense of agency about their own health and to reduce the pressure on healthcare systems. It can cross between primary and secondary care. For example, if you know that you have surgery coming up, engage with a Get Fit for Surgery program. You minimize your risk of complications, which of course has a planetary impact itself. And within primary care, we have so many opportunities, and secondary care in clinics, to make every contact count, to make it a public health education opportunity when time allows. But I think that treating disease efficiently with minimal harm to planet is really essential. And that's where the kind of innovation within medtech and green pharmaceuticals really comes into its own. We need, of course, the infrastructure around us to be able to deliver low impact care. So clinicians do engage with organizations to create the green plans, the sustainable development plans within those organizations, looking at estates and facilities, travel and transport, sustainable models of care, use of pharmaceuticals and consumables, etc. But I think we also need to have a lot of education that spans the delivery of healthcare and treatment of disease with patient expectation, because we've seen this massive shift in patient expectation over the years. Whereas, people do believe that life can seem to go on forever. And they're shocked sometimes when even somebody in their 90s becomes sick. They were well yesterday, they were amazing, and they're not today. How can this be? And so I do believe we need to manage expectations. All of healthcare has the ability to cause harm to the planet, and we should not be providing care that we do not believe is going to make a difference. I don't think there is any place anymore for the give it a go mentality just because we can. I think we have to really become the best communicators with patients and their families and deliver realistic expectations. When it comes to the delivery of care itself, I mean, it's endless what we can do. There is so much what we can do. And on my own critical care unit, we have addressed sustainability from many angles. We think about sustainability in every single huddle that we do at the beginning of the day with all the multidisciplinary team. We talk about it. We talk what we can do to reduce the impact on the planet through sensible care with patients, through reduction in our use of consumables, especially single-use plastics, in moving to oral medication rather than intravenous medication, where we see products that we want to use that we believe to have a lower environmental impact. Well, let's talk to our procurement teams. Let's get them to order these products in. And if they do, I won't say resist is too hard a word. If they do express concern that the cost is higher, then we explain to them that actually using a less sustainable product causes unnecessary, avoidable harm to planet and therefore people. And this has a cost in its own right. So we have to really break down these barriers between ourselves as clinicians, procurement teams, the suppliers of our products. We need to make our suppliers realize that we understand things like PVC are a particularly bad plastic, and we don't want to see it in our products because of all the additives and the harm this does to those individuals tasked with making the PVC in the first place, usually many miles from where we are delivering healthcare, all the way through to the disposal of this PVC with all the thousands of additives that may be in those products. So there is so much that we can do as clinicians, all quite small scale, but cumulatively, I believe they are very much worthwhile. And most importantly, I believe that they are an excellent way to educate and raise awareness. It's very critical that we educate our staff as to, in such areas that, we should never open products just in case we require them. We should only open things when we actually need to use them. We should support our trainees and our junior colleagues that if it takes them an extra 5 seconds to open a piece of equipment and that patient happens to have a slightly rockier pathway as a result, I work in anesthesia, everything happens very, very quickly, that we will back them up. We will say to them, you know what, guys, if it takes you an extra 5 seconds, we will never hold you responsible because you'll never know what pathway that patient would have taken anyway. Maybe it would have been exactly the same, and a few seconds doesn't really matter in the grand scheme of things. And I think it's also really important to make people aware that once they've opened something, it becomes waste. There is no other pathway for these products, single-use products. And optimization of waste streams is massively important because the difference in the environmental impact of processing waste, depending on which waste stream that you go down, is really quite phenomenal. And it is one of the biggest actions that we have delivered, certainly in some of the clinical areas that I work in.
I mean, there's nothing that you haven't said there that as an engineer that doesn't ring true for me. And especially around the issues of supply chain, particularly. And I know we're going to come on to that in a little while, but we don't often, particularly in the NHS as well, because we have this free at the point of care arrangement with our healthcare, we don't necessarily tell patients the cost and value of the treatment that they're receiving, do we? Whether that's the medical equipment that's help them through their period of ill health, or whether that's the medicines that they take back home with them to take after care. We're not really educating them, as you said, into understanding the value associated with that package of care. And I think that's something that we need to get across to society, don't you?
I think one of the most powerful things that we can do, Helen, is to embrace this concept of clear education, communication, and inspiration of others. I think these three words, education, communication, and inspiration, are really important. And that's why at Critical Care, we don't have many opportunities to educate patients because a lot of our patients are unconscious. But what we can do, same with anesthesia, what we can do is we can educate the staff who are supporting that care. And we're finding that we're getting feedback on this as well from staff. When we talk about things such as single-use plastics and the cost of these to the planet and the different types of plastics that we use in healthcare, that, some plastics that we believe are worse than others from the material scientists, that actually when we educate our staff, they're taking this education home with them. When we segregate waste in hospitals, they start doing it a little bit more at home, because they start understanding the value in this, especially when we talk about these waste pathways. And for example, our yellow bin waste, our hazardous waste, especially sharps, going off, 200 miles to a cement kiln. So if you put all your pharmaceuticals into that yellow waste stream, they're traveling a long, long way with its own footprint. They are going into a cement kiln. There is no energy from that waste. If we put them into a blue medicinal waste stream, they travel 16 miles and we get energy from that waste, and it financially costs a third of the cement kiln pathway. So once we actually start talking about this in our huddles and saying to people, look, guys, get residual medications into the blue waste stream, because it only travels 16 miles, it costs us 300 versus £1,000 per ton, and we generate energy from waste, it makes them feel good. And then when they go home, they start doing waste segregation to a greater degree.
Yeah, that's a fantastic opportunity, I think, for anyone who's listening from the clinical setting, that just these small changes within their own teams can have a knock-on effect out into the community. And I think that's a great way of sharing that knowledge. So thanks for that, Richard. I wanted to come on to your work as co-founder of Healthcare Oceans. You've already spoken about your passion for this particular area. You set up this organisation in 2020 with the aim of ensuring that the ocean and nature are not left behind in the journey towards true healthcare industry sustainability. I think that's a wonderful, all encompassing phrase. And you're particularly interested in the interrelationship between healthcare, procurement, container shipping, and molecular pollution, and how this is adversely affecting our marine life. So I'm fascinated to just explore this a little bit more and understand your involvement in this, how it came about, and what you could share with us in terms of the significance that container shipping has on our relationship to healthcare.
Yeah, well, it was an unexpected kind of twist of career direction, shall I say. I, as I've declared, I am an ocean enthusiast. I absolutely love ocean life. I just think it's the most fascinating ecosystem on the planet. And I was just really aware that whoever I was talking to in these early days between kind of 2018, 2020, I would be sitting there and people were talking about the land. They were talking about states and facilities, travel and transport, hospitals. They were talking about the atmosphere, CO2, sequestration by trees, etc., planting trees as solutions.
Yeah.
And I just kept on thinking whenever I heard people talking, well, what about the ocean? So whenever we were, obviously, as we headed towards COVID, especially lots of virtual meetings, and I just kept on putting my hand up in these meetings and saying, why aren't we talking about the ocean? What about the ocean? And pretty much the response for about a year was the same. And it was, what about the ocean? And move on. And it was in one meeting, and exactly, people were just like, why, what's the importance of this? And I didn't have time to explain in these meetings. It was me just kind of chipping in with a question. So in one meeting, I put my hand up and I said, look, why aren't we talking about the ocean here, guys? And I was reading more and more about it and becoming more and more concerned. The ocean has really undergone unprecedented changes. It is warming, becoming more acidic and more hypoxic at a rate that is terrifying. I think I've mentioned already before the change in pH. And this was worrying me, that if we left the ocean behind, we were going to focus on our CO2 output and our CO2 sequestration through land, maybe tech. But what if the ocean, if it destabilized, made all this for nothing? And so I wanted healthcare to start understanding this interrelationship between human health and the ocean and healthcare in the ocean. And I was really lucky in one meeting that somebody just kind of sat up in their chair and said, oh my God, you've just mentioned the ocean. I've been thinking about this too. And that was Georgie Soman, who is a GP from Northumbria. Georgie and I got together. We started sending out emails to everybody we knew in senior positions to say, we want the ocean to be included within human healthcare strategy, because if we don't include it, we're going to regret it. And eventually we were signposted to a lady called Laura Fleming, who was a professor in Exeter and director of the European Centre for Environmental and Human Health. And we jumped on a Zoom call with her and she just said, oh my God, where have you been all my life? Two active healthcare clinicians who are working at the coalface who want to talk about the ocean. So we formed Healthcare Ocean as a brand. We're not really an organization. We're a brand that we operate under to deliver communications, to raise awareness about our dependency on the ocean. So we are dependent upon it for climate regulation, carbon sequestration through biological carbon pumps, for food, for medicines, for leisure activities, for our physical and mental health and well-being, our supply chains, for dozens of new medicines. And, for anyone out there who loves social media and everything else, for our internet connection. Pretty much all of our internet traffic goes under the ocean. So much within our lives is dependent upon a healthy ocean ecosystem. And yet we know that net primary production, due to the climate and environmental emergency, is shifting away from low latitudes. It's redistributing. We are going to get these big impacts, as I've mentioned already, on things such as food security in low latitude regions, especially in the global south. And so we started to think, well, okay, we can talk about the ocean, but what can healthcare do about it? Where are the touch points? So we kind of defined 4 touch points. Really our interface with the ocean ecosystem and coasts and rivers in terms of our human interface as these with these as natural systems. For example, we need to have a very responsible relationship with these ecosystems. We can't suddenly prescribe trips to the beach for 40 million people and not expect harm to occur to these ecosystems unless we interface with them in a responsible manner. Plastic pollution, a massive area, obviously macro and microplastics, especially for the ocean. 10 million tons of plastic finds its way into the ocean every year. We know plastic production is increasing. We know they're full of nasty chemicals. We know microplastics are ubiquitous throughout our ecosystems. We believe that they cause human harm. We do not know the full extent of this. So again, massive link there between healthcare, consumables, plastic, and the ocean. Molecular pollution through all chemicals, including our pharmaceuticals. I found out that our hospital liquid waste basically goes into the municipal waste streams, sewers, which goes to the regular community sewage treatment works, which then goes into our rivers and into our oceans. There is no special treatment for this hospital wastewater. It is very cheap to dispose of tons and tons of hospital wastewater, so it's never particularly high on the agenda to be addressed. And then, as an island nation, I became aware that pretty much all of our healthcare goods were coming in on big container ships. I started looking at the container shipping industry. I suddenly realized here was an incredible force for good that delivers hundreds of millions of tons of grain, all of our med tech equipment, most of our pharmaceuticals, all coming in on these container ships. Amazing industry, very secretive, very hard to reach, and yet it has an impact on the environment, not just through the CO2 and other emissions into the atmosphere, but through underwater radiated noise, transfer of non-indigenous species, marine mammal collision, all of these sorts of things that were happening to deliver us our goods into the UK to use in healthcare, to feed us and to provide us with luxury goods. And all I could think of, well, here is an industry that needs to understand its impact on natural systems and human health, and they need to start seeing themselves as the enablers of better health if they make changes through their operations, whether it be the fuels they use, the way that they operate their ships, the routes they take, the speeds they travel, etc. So I started reaching out to the container shipping industry.
That is just an incredible story. I mean, in that process, obviously you've learned an awful lot about the container shipping industry. What response have you had from these organizations?
Well, it's been really interesting, Helen, because I started out thinking if I just reach out to the container shipping industry, and obviously container shipping is one part of the maritime industry. So there are all sorts of bulk carriers and obviously tankers, etc., and cruises and all these sorts of things. So it's a vast industry, but there's about 5,500 container ships on the ocean. The biggest of which are longer than the Empire State Building is tall. I mean, these are huge,
Wow.
and they are the most efficient, financially and sustainable way of moving goods around the planet. So I thought if I just could find ship owners, talk to them, raise their awareness, things would change. So I started at COP26. I spoke to the container shipping industry a couple of times at COP26. And they were lovely people. They were already engaged, but they're basically saying, look, we are quite a passive industry. We build these ships. We put the fuels in that are available. We shift the goods that you give us. There you go. If you want us to change these newer, cleaner, more expensive fuels, those changes will have to be borne by the freight buyers, the cargo owners. So after about a year, perhaps a little bit longer, I started realizing that I couldn't just put pressure on the container shipping industry. I had to go to our freight buyers. So naturally, I reached out to our 80,000 suppliers to the NHS with the help of NHS England, who have been absolutely incredible, the Sustainable Procurement Forum, Alexandra Hammond, Daphne DeLuna, wonderful people who have supported this project immensely. And we started talking to our healthcare freight buyers. Now, what we started saying to them was, look, you're supplying us with all these goods. That is wonderful, but our healthcare cannot come at the expense of the planet or other communities around the world. So you have an additional moral responsibility to reduce the environmental and human impact of your maritime logistics. So you may have to pay more to procure space on ships with cleaner fuels, but if you don't pay more, we don't facilitate that transition to cleaner fuels, we are going to cause avoidable harm. That is unacceptable. And also the planetary trajectory means that we will cause undue pressure on healthcare, which will ultimately fail. So our tact has very much been, let's reach out to our healthcare cargo owners. Let's really get them on board from a perspective of the moral responsibility. And with the new carbon levies coming on the heavy fuel oils that are present being used by most container ships, there is an emerging business case for change as well that will kick in over the next few years. So those first movers will hopefully gain the most with respects to the reduction in the carbon levies placed upon these suppliers as they're introduced by the International Maritime Organization. So the response has been one from quite passive through to amazing. So if you take Philips Healthcare, I'm going to name them because they are a leader in this area. They joined the Zero Emission Maritime Buyers Alliance a few years ago. They are engaging 100% with this agenda. And that is the sort of movement, the first movers that we need to see within our industry. And then we need to create that story and tell it on a global level. Why are our healthcare suppliers paying more for fuels in order to ship their goods around the planet? Because they want to avoid, they want to reduce causing avoidable harm to planet and people. And then we have the story, and hopefully we can then stimulate the investment on a global level and accelerate the transition to cleaner fuels.
That's an amazing journey to be on, and it's great to hear that one of the largest medtech manufacturer, pharmaceutical manufacturer, are getting on literally on board with with this kind of thought process and changing the way that they manage their supply chain and the systems that deliver all of that technology. It's great to hear that you're driving change at that kind of level, which is wonderful. And I wanted to just, I mean, it leads on really nicely as well to you being involved with the Veer Voyage. Now, you're on the advisory board for the Veer Voyage, and is this going to be the first ship of its kind that's only wind and hydrogen powered? We'll kind of come to that, and what impact is this going to have on international shipping? You've already talked about the cargo industry getting on board with what you're doing, but are ships like this going to really change the way international shipping happens, and what knock-on effect is that going to have on global health?
Yeah, well, Veer Voyage is fascinating. They're run by a really inspirational CEO, Daniel Southcott, and an amazing team. And I first heard of Veer at a talk at Monaco Ocean Week when we were launching the Minderoo Monaco Commission paper on plastics and human health. And the individual who invited me to Monaco Ocean Week, he knew of my interest in ships, so got me an invite into one of the shipping days. And I heard Danielle talk about Veer, and I just remember this overwhelming kind of urge to kind of stand up in the ballroom on Monaco Yacht Club, feeling very small and nervous, and grabbing the mic and shaking and saying, oh my God, this vision is just incredible. I one day want to see all our healthcare goods delivered to the NHS on your ships. Thank you, sort of thing. And ever since then, I maintained a relationship with Danielle and Veer, which has grown. So Veer want to be the first shipping company that do a transoceanic voyage delivering container cargo using wind and hydrogen fuel cells. So that's the vision. That's what they want to do. They know the shipping industry is vast. They know that the amount of cargo being moved is just incredibly huge. But what they really want to do is to demonstrate what is possible through this fresh way of thinking. So yes, they want to be a first mover in the space of zero emission shipping across oceans. And I think that is a vision that is really worthy of support, because the way that I view planetary trajectory, the way that I view the emissions from the shipping industry, we need this kind of technological advances in order to reduce these impacts. And I do believe that this utilization of natural resources like wind for not just container shipping, but for bulk carriers and other types of ships is an absolute no-brainer. We have to start using these natural resources that are zero emission. And obviously, if we combine with hydrogen fuel cells as this technology progresses, then, we have some solutions which hopefully can then be scaled. So I think VIA is very exciting. I'm very happy to be part of that. And, what I am hoping to do again is to utilize VIA and their vision to be able to explain why this is so important for planetary and human health, because we have to reduce the impacts of all these operations on the planet and reduce the impact on human health, which then puts strains on healthcare systems. So this is one part of the puzzle that I'm really proud to be a part of.
What's the timescale for the ship to be, in service?
Well, I may regret saying this because I may be wrong, but certainly I'm going to keep it vague so that I don't get into trouble. But I think it's a whole number of years. I believe.
Right. Okay.
So,
because being able to collect the data from that ship to be able to then demonstrate to suppliers and shipping agencies and so on that this is a viable way forward, that's going to be really critical to the success of this program, isn't it?
It is completely. And, I'm really interested again in facilitating the ability to collect this data, to demonstrate the art of the possible, and to plot that future scalability and pathway. Because what I would love to happen, and again, this is vision at the moment, so this is not reality, this is a hope, is that I can find a first mover from within the healthcare supplier sector. So I can find an environmentally ambitious organization who says, do you know what? I want to be one of those first that puts their containers on a VIA ship and ships them to a sea or an ocean to show that healthcare understands the impact of this industry on oceanic and human health, and be able to create that story to explain why we are supporting this project. So I really want to find that healthcare supplier to support this program of activities, because I think that is an essential story to develop.
Definitely, and I am sure you will have people jumping at that opportunity. It's a great way to demonstrate the effectiveness of this kind of technology, and I would love to have you back on the show when that ship finally sets sail, and we can talk about the successes and the achievements of the VIA program. So that's fantastic. I look forward to hearing more about it in the future. And talking of the future, what do you hope can be achieved, not just through the work that you're doing personally and Healthcare Ocean, to address the impact of climate change on health? And what can we, as just ordinary people, do to ensure that we're not contributing to our own ill health?
I think from the perspective of healthcare systems and other industries too, I really think we need a global recognition of the importance of good planetary and human health. I think we've got to see this just recognized as a core feature of every bit of sustainability planning that we do. We need good health to mitigate, adapt, innovate, and fight the climate and environmental emergency. Healthcare is an essential industry. It is not exempt from responsibility. It has to do all it can to minimize its own pollution footprint, whether that be greenhouse gases or pharmaceutical pollution or whatever. But we have to also stand proud as a healthcare system, and we have to find our voices and be able to inspire everyone to put health at the center of all their thoughts, whether it be the shipping industry, whether it be any other industry, because once the health of those individuals within those industries fails, and once healthcare cannot keep people healthy, our ability to change just disappears. So if I had, my dream is that we have this outbreak of global social democracy, of course. I think it's defined as shared economic pathway once, a sustainable future, that we live within planetary boundaries, that providing a safe operating space for everyone and dignity for all. That would be, my goal, of course, but the world doesn't seem to want to move in that direction at the moment. So if I then go back to, well, what can we do within healthcare? Let's find our voices. Let's use these trusted voices to not just communicate internally. I don't think we should get, and this might be unpopular with some other people who are working in this space, but I don't think we should get too hung up with the footprint of healthcare. We have to do all we can within our industry to minimize that footprint, but let's not forget, we, along with a lot of other industries like agriculture, like, those that build infrastructure, we are essential industries. We are the good guys as well. And we have to stand proud, articulate that, but then kind of really inspire others to want to change, to maintain the health of both themselves, their loved ones, and the planet. So that's the kind of global vision that I kind of see. And I really want to figure out, certainly this year, next year, a way to use my own voice better in order to stimulate action within these industries external to healthcare. As individuals, I think the most important thing we can do is stay healthy. We need to maintain our health, reduce our personal impact upon healthcare systems and our personal impact on the planet. So from the point of view of reducing personal impact on the planet, it's all about reducing consumption. And if we reduce consumption, we reduce our waste and pollution footprint too. I think by consumption, I think it's a very broad term. We can think of consumption in terms of the miles we consume in our cars or on planes or whatever. We can think about the foods that we consume, obviously moving to plant-based diets. We can think about the stuff we consume, the luxuries, the plastics we consume, the chemicals that we use. I think it's pretty much, we just have to look at becoming a lower consumption society in general. I think other people call it degrowth. But anyway, I'm not an economist. Just on the economist side, we have to divest from any industry that harms the planet unnecessarily. And we know that is the bulk of the plastics industry and fossil fuel industry. I believe as individuals, we should all be fighting for equality and fairness across the planet. I think that is absolutely essential. I think greed and inequality has been the primary driver of the climate and environmental emergency. I think we have to look beyond greed and inequality and create a far more egalitarian society. And on an individual level, I think we all need to become better educated, better communicators. We need to find our voices to inspire others. So that's what I think we could do on an individual level.
Richard, that is really quite inspiring and also achievable as well. These are not things that are out of our reach as the human race, are they? They are things that we as individuals or as organisations can really put into practice and make work. And by creating a system of systems to solve this problem, we should be able to overcome this as the human race, really, shouldn't we?
I believe so. I think we really need the political will to back up the individual ambition, and I just hope that we do start seeing that kind of buy-in at senior leadership level across governments, but that this is given the same priority as other areas. I still see growth mentioned just far too often, and I just wonder if the growth is in the right areas. But I'm not a politician, and so as far as my own actions are concerned, I focus on what I can achieve rather than what I can't achieve.
Well, there's nothing to stop us having green growth, Richard. That's
Absolutely.
the important thing, I think.
100%.
One last thing I wanted to ask you, and maybe this is a slightly leading question, but if companies or healthcare professionals or anyone really are looking for ways to educate and communicate issues on net zero and sustainability, where can they find really good support?
One of the things I did realize very early on in my journey, again, we're talking back in kind of 2017, 18, I was really aware at the time that a lot of my colleagues were not aware of medical healthcare education that was occurring on their doorstep. And I was very aware that if I wanted to go traveling somewhere, let's say I wanted to go to Paris and I wanted to find a hotel, I wouldn't go around 2,000 hotel websites. I would go to an aggregator site like booking.com, and I would find out what was available for the dates I was going. So I had this being aware that some of my colleagues were traveling unnecessarily, some of whom were flying across continents to receive education that they said was not available on their doorstep. I wanted to develop an aggregated site like booking.com. So I developed something called CPD Match, which stood for Continuing Professional Development. That's the CPD. The match bit was that we matched individuals to education that was local, virtual, and with a lower environmental footprint. And I wanted to be the kind of booking.com of global healthcare education, but most of the resource came from myself, plus some very kind support from Health Education England and the Academic Health Science Network. But basically, we overreached with the project, and it kind of limped on for a few years until 2023, when it suddenly dawned on me that the whole project should be focused on climate and environment, because that education was the most important education for healthcare professionals to find. So I then extended the value proposition to capture the whole value chain. So healthcare professionals, their employers, and all supplier industries. And we rejigged all the categories on CPD Match to make them all environmental. So we created a website where you can find education to improve your climate and environmental literacy, to help keep you and your loved ones healthy, both physically and mentally, to understand the impacts of the climate and environmental emergency on your clinical area and the solutions that were out there, and to also support those who wish to develop as leaders and communicators. And so, yeah, I mean, I'd recommend people go along to CPD Match. It's free to use. It's free to advertise education. It's free to register. We are very kindly supported by environmentally ambitious organizations now so that we can develop the platform. I would warn everyone, it is still a work in progress. Most of the work takes place from the desk that I'm sat at now, along with a very lovely and talented software developer. I'm not that developer. That's somebody else, a very good friend. But we have really good plans, great plans to develop this into a platform that has the maximum value for everyone working in the value chain. And all the education on there is created by reputable education providers and through reputable publishers. We screen everything to make sure that it's relevant and it is of high quality. And yeah, that's a great place to start. And I'm not sure there's anywhere else like it at the moment. So I thoroughly recommend people visit.
That's fantastic. And we'll put all the details of that into the episode notes as well, so that people can find their way to that website as well. Richard, thank you for joining me on today's podcast. It's been really inspirational, not just to hear your personal journey, but how that personal journey has developed into really engaging with people across the world to understand the climate crisis and how that relates to healthcare. And I wish you well for your future endeavours, because it sounds like you're going to be leading the charge in this for many years to come. So thanks for joining me.
Thank you for inviting me.